Hi, my name's Betty. Thanks for joining me on my channel, Mental Health Matters. I am not a professional mental health person. I just think it's important that we start talking about mental health to get rid of the stigma that surrounds it. Mental health, you might ask, what is it and why is it important to me? It's important because your mental health includes your emotional, psychological, and social well being. It affects how you think, how you talk, how you feel, and how you act. It also determines how you handle stressful situations and how you relate to others and how you make healthy choices. Mental health, it's very important at every stage in life. Mental health, it's just as important as your physical health. Mental health disorders such as depression increases the risk for many types of physical health problems such as diabetes, heart disease, and stroke among others. Also, chronic conditions can increase the risk of mental illness. This is why it is so important to take care of your mental health, just like you do your physical health. It's important to remember that your mental health can change over time. When the demands placed on you exceed the resources you have and your abilities to cope with it, your mental health can be impacted. For instance, if you are taking care of a loved one, or if you're working long hours, or if you're experiencing some kind of economic hardship, this all will affect your mental health. Study shows that mental illness is among the most common health condition in the US. Some statistics show that more than 1 in 5 US adults live with a mental illness, and 1 in 5 youth ages 13 to 18 that either currently or at some point in their lives have had a debilitating mental illness. And 1 in 25 US adults live with a serious mental illness, such as schizophrenia, bipolar disease, or major depression. There's no single cause for mental illness, but there are some factors that contribute to a risk for it. And this includes childhood trauma, or a history of abuse, or witnessing violence, ongoing medical conditions like cancer or diabetes, or a traumatic brain injury. These all are risk factors. There's also biological factors that can contribute to mental illness, along with chemical imbalances in the brain. Using alcohol or drugs also can be a factor. Feelings of loneliness and isolation. This also is a contributing factor to mental illness. Mental health is an integral part of your health and well being. It impacts your ability to make decisions and to build relationships and to shape the world you live in. Mental health, it's a basic human right, and it is crucial to personal, community, and socioeconomic development. Mental health, it's more than the absence of a mental disorder. Everyone experiences it differently, and they have different outcomes. If you have a mental health problem, you may experience a lower level of well being, but not always. Psychological and biological factors such as substance use, genetics, and emotional skills can make you more vulnerable to mental health illness. Things such as poverty, violence, and inequities, they also contribute to mental health disorders. Risk can manifest at any stage in life, but those that occur in early childhood are detrimental. Some examples are harsh parenting, physical punishment. These all will undermine a child's health. Bullying, it's one of the major contributing factors for mental health conditions. Things such as a positive social interactions, quality care, decent work, safe neighborhoods, and close communities, these all will strengthen your mental health. Stress, depression, and anxiety, they are all things that can affect your mental health, and they can disrupt your routine. Many mental health conditions, they have physical roots. Peak mental health, it's about managing active conditions and maintaining wellness and happiness. Preserving and restoring your mental health, it's extremely important. Statistics show that 1 in 5 adults in the U.S. experience mental health problems each year. Everyone is at risk of developing a mental health disorder, regardless of your age, sex, your income, or ethnicity, or race, or culture. Depression, it's one of the leading causes in the world of disability. We will dive into this specific condition in future episodes. It is possible to have more than one mental health condition at the same time. But self-care, that can play a big role in maintaining mental health, and it can help support your treatment and recovery. If you have a mental illness, mental health is an important part of complete health. It decides how you think, how you talk, and how you behave. But unfortunately, though, mental health in the U.S., it should be just as important as your physical health, but it is largely ignored and underestimated. Often issues related to mental health, they go completely unnoticed. And this is because, as a nation, we are largely not aware of what mental health really is. But like all things in nature, the human mind, it also needs nurturing. Often, emotions, it's the one thing that is ignored the most. It is estimated, though, also, that 1 in 7 people go through some type of mental health issue globally. Illnesses like depression and anxiety disorder and paranoia, they're becoming more and more common as life gets more stressful every day. And it has been shown that suicide has become one of the leading causes of death among youth due to mental health issues. People with severe mental disorders are more likely to die young, as much as 2 decades early. That's a very alarming sign. Roughly 282.6 million people worldwide suffer from an anxiety disorder that is developed later in life. It is reported also that 264 million adults suffer from depression. And these are just the cases that have been reported. Billions of people suffer in silence throughout their lives. Mental health, it plays an important role in helping you live life and deal with situations and manage situations during bad times. If your mental health is not good, then you cannot do even the small task of daily life properly. Mental health issues, they can be hereditary, as well as due to social and economical surroundings. And your background, that can also play an important part. It can be caused by stressful events, by your gender, and by racial discrimination, also by your upbringing. These are just a few of the factors involved. Sometimes mental health issues, they are detected at a young age and they can be treated early. Sometimes they are triggered by a traumatic event in your life. Economic and financial issues are also a major risk of mental health problems. As living becomes more and more difficult and earning a living becomes more and more difficult, other economic situations such as unemployment, inflation, these are all stress factors, and that can lead to severe mental health issues. The rise in the cost of basic necessities like food and transportation, that becomes a major risk for mental health because it puts more pressure on you. Also, the influence of social issues is one of the prominent risk factors for mental health issues. Your social class, background, and upbringing all play a part in your individuality. People of developing countries, they are at a larger risk of a mental health problem. But people from first world developed countries are usually at a lower risk. This is because people have different access to basic necessities. However, like I said before, anyone can be at risk in developing a mental health issue. Life experiences can be one of the biggest factors in a mental disorder or in our well being. Any experience that leaves you in distress and creates an emotional scar, that's trauma. And such trauma that can cause multiple mental disorders. These disorders, after experiencing a traumatic event, are actually caused by physical factors. When you experience a trauma, your body defenses, they start working and they create a response to that stress. Due to this, your body goes through sudden changes. It's a coping mechanism. It can have adverse effects physically and mentally on your body. It's part of your stress response. It's your body goes into that fight or flight mode. And in response, the following symptoms may occur. You may have a rise in blood pressure. Your heart rate increases. Excessive sweatiness. A loss of appetite. Nausea. Exhaustion. Prolonged exposure to such trauma, that can lead to severe damage in your mental health, like paranoia, schizophrenia, along with post-traumatic stress disorder. The severe stress disorders, they may not necessarily be visible or even detectable immediately after trauma. It can take years to start coming to the surface and affect you. Some of the facts of trauma, it can be emotional stress, emotional imbalance, numbing, memory blockage, and many more. Multiple biological factors, they can affect your mental health. Defects during birth, hereditary factors, substance abuse, exposure to toxins, brain injuries. These are just a few of the factors that cause mental health problems. Alcoholism and other drug use of a parent during childhood can cause severe mental problems in children. If a parent has alcohol or drug problems, this can affect the mental health of children growing up. Mental health issues can also be inherited. If one parent has a history of mental health issues or any other close family member, then the child may also develop similar issues. One of the causes of mental disorders, it can be brain damage, either in birth or other phases of your life. Severe brain injury can have a lifetime impact. A severe injury can lead to disorders like depression or schizophrenia, bipolar disorder, and organic mental disorders. Organic mental disorders, it's from a decreased in mental activity due to disease or illnesses. And usually mental disorders, after a brain injury, they usually start in the first year after the head injury. But however, in some cases, these disorders have been detected even after 15 to 20 years after the injury. Most mental illnesses, they hardly ever appear out of the blue. Most times, these disorders, they show up in small signs. Often, due to the lack of awareness, these early signs of mental health issues, they get overlooked or ignored. Sometimes they're difficult to understand and analyze and detect in an early stage. Yet, if these signs get noticed at an early stage, severe mental disorders can be stopped or controlled. Some of the early warning signs include mood swings. Rapid changes in mood is one of the most important signs of mental problems. This usually occurs due to suppressed feelings and emotions, or as a result of unplaced emotions. Loss of appetite is another sign. Trauma response causes changes in your stomach activities, and loss of appetite becomes very common in such cases. Also, mental issues like depression can cause a loss of appetite. Changes or loss of sleep is also a sign that you may be suffering from a mental condition. When you're not mentally well, it can be an extreme change in your sleep schedule or a complete loss of sleep. And this may occur due to the restlessness of the brain. Social withdrawal, That's another red flag. Most people who started to develop mental health illness, they also withdrew from their social activities and they lost interest in activities that they previously enjoyed. There are many different aspects and many types of mental disorders. Some of the disorders are more common than others. A few of the most common disorders that affect the whole world is depression, and it is one of the most common mental disorders worldwide. Approximately 64 million people are affected by this disorder. Anxiety disorder, it's another one. It's a feeling of excessive anxiety and worries for a prolonged period of time. Along with this, there also can be feelings of restlessness, fatigue, and disturbed sleep. In the US, the average life expectancy has steadily increased to 78.6 years. However, the life expectancy for people with severe mental illness, that ranges from 49 to 60 years. This is 15 to 30 years less than the general public. Additionally, people with depression have a 40% higher risk of developing heart disease than the general population. The second leading cause of death in people between the ages of 10 and 34, it is suicide. Mental illness and substance use disorders are involved in 1 out of every 8 emergency room visits by adults. Mental health can affect your day-to-day life, your relationships, and your physical health. External factors in your life and your relationships can also contribute to your mental well-being. Looking after your own mental health can help you maintain your ability to enjoy life. There are treatments available. For long-term help, a person with a mental health illness must visit a psychiatrist or psychologist for better treatment and counseling, depending on the severity of their mental illness. But the first thing you need to do is to show kindness and empathy towards a person going through a tough time. This also includes yourself. Small acts of kindness can help a person going through mental illness to open up and share their burden. Taking preventative measures and providing good health care for mental illnesses, they are as important to help break the stigma surrounding mental health. The awareness needs to be spread that mental health illnesses are the same as any other illnesses and are treatable. People need to understand that with professional help, most of the common illnesses like depression, anxiety, they can be controlled or cured. And also, severe illnesses like OCD, bipolar disorder, and PTSD at least can be controlled so that they do not make living daily life a struggle. But one of the most effective preventative measures for mental health illness is self-care. Taking care of your own mind, that should be your first priority. Even when you're going through difficult times, like physical illness, mental illness may need medical assistance, and there is no shame in that. Mental health is real, and it's important. Maintaining the well-being of mental health, it is a necessity to survive in the tough world that we live in today. We need more care and empathy. The taboo surrounding mental health, that needs to be demolished, and more awareness needs to be raised. The more we talk about mental health and mental illness, the more they become normalized and will lead more people to seek help when in pain rather than hiding in the darkness of their mind. By not talking about mental health, we add to the stigma that surrounds it. Some effects of the stigma include discrimination, lack of understanding by family, friends, and coworkers, and others. Violence or harassment, they become more prevalent. You start to believe that you'll never succeed at certain challenges or that you can't improve your situation. Stigma can lead to a reluctance to seek help or treatment. Nearly 20% of Americans will experience a mental illness in their lifetime. However, fewer than half of these who experience a mental illness will seek treatment. Mental illness is treatable, and people with mental illness can have a productive and happy life. But the longer mental health conditions go untreated, the more severe they become. Talk openly about mental health. It's perfectly normal to talk to friends and family and coworkers about seeing a doctor if you have the flu or an injury. So talk to them also about seeing a therapist because you're depressed. This normalizes mental health conversation, and it makes it easier to get rid of the stigma. If you're talking to a friend or loved one, be direct. Being hesitant to talk about it, that only adds to the notion that it's a taboo topic. Mental health conditions are often viewed negatively, which is a big problem. Try to be conscious of the words you use to describe people, things, and behaviors that you think are different from yours. One way to look at mental health is like thinking about the weather. When the seasons change, the weather does too. There are bright sunny days that you feel happy and you want to be outside. And then there are other days the weather changes to darker, rainy days where you don't feel like leaving your house. Just like the weather, your mental health, it can go through periods of positive and bright bursts of energy, and it can also change and drag you down. You may feel tired and have a lack of motivation or the energy to do simple things, such as even getting out of bed or getting on with your day. Whatever you're feeling, remember, it is normal. You can seek support. Speak to family or friends about how you are feeling. Many people are reluctant to talk about their feelings and mental health because of the stigma surrounding it. However, by not sharing your feelings with anyone or even knowing what they are, this can make your mental health worse. Talking can help you to find hope again, and it'll help you feel closer to other people. Your mental health may change because of situations you're in, things you're doing, and things beyond your control, including other people. You are affected by what happens in your past and present. Things that happened even years ago can affect your mental health. When your mental health is good, you feel good inside. You might feel calm, content, peaceful, hopeful. Everyone has ups and downs in lives. It's full of risk and worries and losses. Sometimes difficult feelings, they pass quickly and you bounce back. Sometimes you struggle for longer periods of time. This can happen to anyone. When your mental health is not good, life feels like more of a struggle. It can be hard to keep going when you feel like this. But feeling like this for a while, it can be a sign that something else is wrong in your life and that you need help. It is also a natural reaction. Today, there are highly effective treatments for mental illness. People can and do recover from mental health problems. Recovery can be a process rather than a particular outcome. The recovery process does not always mean getting back to where you was before. You will have up and downs, but it requires commitment from you and support from family and friends. The recovery process can allow you to lead a normal life. It will involve finding your own way of coping with life's challenges. For many, recovery is about staying in control of your life despite experiencing mental health problems. We all have to talk about it. We have to stop the stigma surrounding it. Thank you, and a good Jen. I appreciate your support. Thank you.